And you just listen to a young girl who was saying that the Nigerian community here is totally very angry. Covers all the aspects of various techniques of our journalists.
This was the Ijo country of the Niger Delta of the Federal Republic of Nigeria. He went to several schools to make your academic services was at government college to Delhi. And
go gather, destroy their food. Make cultivated camp and that other camp, some more camp, you don't compensate everybody. But some of them
in its key generation sometimes. Today our focus will be on the style of J.P. Clark, a poet and writer, and we shall also be very interested in his point Akmo dancer.
Some lives are meaningful, some are empty. Lives that are meaningful, with too much meaning and riches to offer humankind. Long after some of these earthly adventures and no more, one can still find footprints of these big lives on the pavements of our contemporary lives.
Good evening, you're welcome to the program Green Planet.
Good day. Thank you very much for talking to the Copenhagen Consensus for HIV AIDS for Sub-Saharan Africa. What are your names, sir?
Yeah, my name is Peter Louis Ndifor. I'm on family practice in Limbe, Central Africa. That's in Cameroon.
How would you situate the issue of HIV AIDS in Cameroon? Is it widespread? Is it being contained, or are there infrastructural lapses?
HIV AIDS is present in Cameroon. It's there, and as of now, the prevalence of HIV is about between 5 and 6%, depending on the population. And the trend there is that it's still there, and though in certain areas, the prevalence gets reducing, but then it's still within the community. Efforts have been made very, very significantly, both by the government and by the private setting NGOs, to be able to fight HIV. Efforts on fighting HIV had been centered around preventive measures. Preventive measures, have been based on HIV education, and doing the voluntary counseling and testing. These are activities that have been carried out, and initially the testing, pre-treatment workup, and as well as the treatment was being supported entirely by the patient. But progressively, the government have been trying to put a package, from the Global Fund to be able to support patients. And as of now, testing for HIV is a basic minimal package, and treatment and the pre-workup tests that are supposed to be done for HIV patients are free, and they are carried out by the government. So we think that the treatment centers also have increased, and more health professionals in Cameroon have the clinical skills in management of HIV patients. And I think that there's no way in Cameroon now that you go and talk about HIV that people don't know. So we think that health education have been carried out, and the health facilities also have been be able to at least diagnose HIV, and if they cannot manage it, the neighboring health facilities that can be able to take care of HIV patients.
Now, you run an institution that carries out a lot of community work. You do a lot of outreaches in community, and you collaborate with other international organizations to make HIV and AIDS well managed in Cameroon. Can you tell me some of these activities that you do in terms of prevention, care, and advocacy?
Yeah, just like what you just said, the basic activities that family health care carries out is to be able to carry out preventive activities, curative activities, and advocacy. The first one on prevention, the first thing that we do is to be able to carry out community health education. family health care, at the level of the audio visual media, we carry out preventive health talks on HIV, AIDS, TVs, radio, and then we have handouts that we give. We also go right down into the community, within each neighborhood, because what we finally realized there is that HIV fight should not be something that should be distant from the community. So it should be a community-directed action towards fighting HIV. So, like for example, within Limbe, we have several neighborhoods in Limbe, and lucky enough that they have health committees within each neighborhood, and so we actually work in collaboration with each health committee from each neighborhood and carry out a targeted, health education, working with peer groups, and making sure that the information actually goes right down to the grassroots. Apart from that, we also go right up to churches, some groups, traditional groups, and be able to talk about preventive activities. You see, we try to insist more on preventive activities because, by the time you have HIV, it's a lot of headache, to be able to manage it. So preventive activities are very, very much carried out, and we take into consideration the sociocultural values of the people when you are carrying out preventive activities. So apart from the preventive activities, we also go in for diagnosis. Preventive also will want that people should be able to know their status, because we imagine that by the time you know your status, then you should be much more careful. So those who are negative should now be much more precautious, should be able to take more responsible steps to be able to stay negative. And those who are positive should now be able to know that they are positive and actually start their treatment, to go in for screening to know whether they are eligible for treatment or not, and also to be able to test their spouses, because it has been found out that most people who are positive stay married and actually infect other people without they actually knowing that they are positive. So we think that by doing screening, people knowing their status, we could significantly reduce transmission. But then, we were trying to find out whether 20 years after, HIV, came to Cameroon, is the way ahead? Is it only voluntary counseling and testing? We've been trying to talk about it. But then we think that we should move ahead, because voluntary counseling and testing, at times doesn't work. And, it's even found that it's amongst the population, it's even the people who are not married who actually go in for screening. More and more, there's this trend that comes up where you find more and more people who are married who have HIV infection. And so the tendency is that when you go out, people say, oh no, I'm married, I don't want to do my test. And it's been found recently from our statistics that more and more people who are married, have this HIV virus. And so you have to work on the targeted groups. We know the maximum age for adults, it's about 45, and the younger teenage group, that falls in between about 15 and 25. So those groups are the groups that we have to work on. About management, what we try to do is that we try to counsel them appropriately, make them accept the fact that they have their HIV status confidential, and run pre-treatment workup. And as I said before, it is the regional hospital that carries out treatment, and so we work in collaboration with the regional hospital Limbe, and that's where they have their treatment. Treatment, is based on the specific antiretroviral treatment and the treatment for opportunistic infections like tuberculosis. Tuberculosis also, the treatment for tuberculosis is free and is given at the level of the regional hospital Limbe. Treatment for other opportunistic infections also like pneumocystis carinii and toxoplasma, cryptococcus, and all the other stuff. Also, they are basic treatment that actually given free, but these medications are, are actually at the level of the regional hospital Limbe. So it is only working in collaboration with them that we can be able to, to to see that these patients are well managed. Apart from their management, treatment management, you need to understand the psychology of an HIV patient. You need to give a lot of social and supportive care, because most of them are weak. They don't even have money to be able to take care of their homes. Some of them even have families, children that they sponsor in school, but because of their illness, they can't be able to continue working. And
what about discrimination? Are some really discriminated upon based on their status?
Yeah, stigma. That was actually that's actually a very significant point, because stigma, irrespective of how you want to hide the patient's status, somehow from somewhere, is it from the health personnel who go back to the community to be able to talk about the patient's status, or is it because of the fact that the community is now much more knowledgeable and know the sign of signs and symptoms of HIV, that they could be able to identify HIV? I think that is not the point, because irrespective of everything we do, the community will in one way or the other know that the patient is significantly sick and may suspect that it's HIV, which could be correct. But I think, you know, it comes a time where we start thinking more to surpass stigma. Stigma that interests us should be like, you know, why should you not employ somebody who has an HIV infection? Why should you not be able to give, you know, certain services, administrative services, to somebody who has HIV? You know, discrimination from that. You know, why should you, some services that are given to certain people in the society, why should somebody who have an HIV infection not benefit from that? I think it is much more within that line that we should look, rather than saying that, okay, people in the community may suspect that somebody has HIV infection. Because it's very, very important that HIV patients should not be discriminated, because when they do have that, then psychologically it breaks them down, and even their medication may not respond because of, you know, a break in their psychological awareness.
As an institution, what are the difficulties you face in carrying out this kind of duty to society, and what kind of expectations or what kind of support do you envisage from the public and maybe funding institutions in terms of the kind of work you do?
Yeah, I think, as I said before, most of the time you hear me saying regional hospital. Regional hospital means that for us to be able to carry this activity, you know, most of the time we have to fall back on the regional hospital, on the government activity. Even at the level of the government, at times it's difficult, for example, to assess a patient. So the difficulties that we have, first of all, is diagnosing a patient. Because the HIV kits, we have to buy them by ourselves. You know, we don't have any HIV tests from the government trying to support us, so we buy it. So the testing facilities are also very difficult. Number two, you know, communication facilities. So all our activities that are actually at the level of the community are being sponsored from the proceeds that we have from patients who come to consult for other illnesses. So financially it is constraining, and you have to also motivate the staff who are actually going to carry out those activities. That all falls on the Family Healthcare Foundation. The follow-up treatment, the follow-up diagnosis tests like CD4 counts, viral loads. The machine actually is not found in Limbe for now. We hope that, because we hope that we could be able to have a machine here that can be able to, PCR that can be able to run CD4 counts and run viral loads, so that, you know, the patients could be able to have all of their tests carried out here. And drugs for opportunistic infections also, there are some patients who feel that maybe by going to a regional hospital, you know, it helps to improving, to worsen the case of stigma, because, you know, at the daycare center of the regional hospital where HIV patients are actually managed, you know, when you go there, everybody like starts pointing a finger that, oh, the fact that you visit that center means that you are an HIV patient. And so you know, you're trying to think whether that's the best idea of you know, just getting one section that is only meant for HIV, that worsens the stigma. So we think that if at all you could be able to decentralize management, you know, even in each health facility, to be able to manage HIV, then I think it's going to reduce the stigma that we're talking about. So If we could be able to have drugs, medications, we could be able to have drugs for opportunistic infections, we could be able to have facilities to be able to diagnose and do pre-treatment workup, then it will go a long way to be able to help them.
And recently you carried out an international activity with certain organizations in Cameroon and in Germany. What was it about?
Yeah, that's what we call our free community healthcare screening and treatment. One of the roles of, one of the objectives of family healthcare is to be able to carry out, free screening and treatment of members of the community. That was actually carried out in the community in collaboration with Dr. Tembi, who was a visiting doctor from Alice Hospital in Germany, and one of the biggest successes that we had there was that we had a lot of patients who freely came for screening for HIV. Many of them who were positive never ever suspected that they were HIV positive, and irrespective of how bitter it was for them to actually accept the truth. But then I think at the end of it, they found reason for following up their pre-treatment workup, and some of them are actually on treatment. This is a very, very wonderful idea, because most people fear going to the hospital to go and get screening. So if you go very close to them, they could be able to accept for screening, and you may be able to pick up them early enough before they go right late into complications. So we hope that maybe in the next few months we are going to carry out activities like this. Every 3 months we do screening at the level of the community.
Thank you very much, and good luck for the wonderful work you do, and thank you very much for talking to the consensus on HIV AIDS in Sub-Saharan Africa. Thank you very much, Doctor.
It's a pleasure having you in our institution today.
Thank you for watching People, Places and Events. Thank Arrey Ivo.
And you just listen to a young girl who was saying that the Nigerian community here is totally very angry. Covers all the aspects of various techniques of our journalism.
It was the Ijo country of the Niger Delta of the Federal Republic of Nigeria. He went to several schools. His major academic genesis was at the government college in Delhi.
Go gather, destroy their food. With the camp. That other camp, some more camp, no compensate everybody.
In its key generation sometimes. Today I hope we can be in the style of JP Clark, a poet and writer, and we shall also be very interested in his point Akmo dancer.
It's something that needs to be exploited.
Some lives are meaningful, some are empty. Lives that are meaningful, with too much meaning and riches to offer humankind. After some of these earthly adventures and more, one can still find footprints of these great lives on the pavements of our contemporary life.
Good evening, you're welcome to the program Green Planet.